These aren't miracle cures. This is science, delivering precisely what your body needs, exactly where it needs it. Today, on Let's Talk Wellness Now, we're exploring how IV therapy is truly faster than food, revolutionizing wellness as you know it. Welcome to Let's Talk Wellness Now, the podcast where we explore cutting-edge approaches to health and empower you to make informed decisions about your wellness journey. I'm Dr. Deb, and today we're exploring a treatment that's been used in hospitals for decades, but is now revolutionizing preventative health and performance optimization: intravenous therapy, or IV therapy. Maybe you've seen celebrities posting IV drip selfies, or perhaps your local wellness center has started offering vitamin drips. You might be wondering, is this just another wellness trend, or is there solid science behind it? Today, we'll cut through the hype and examine that IV therapy really is, how it works in your body, and the research behind its effectiveness for everything from athletic performance to immune support and chronic illness management. We'll explore why oral supplements sometimes fall short, the different types of IV formulations available, and how to determine if IV therapy might be right for your specific health needs. You'll discover how direct-to-vein delivery of vitamins, minerals, and other nutrients can create effects that simply aren't possible with traditional supplementation. Whether you're a performance-focused athlete, a busy professional battling fatigue, someone with absorption issues, or just curious about optimizing your health, this episode will give you the science-based insights you need to understand this powerful therapeutic approach. So, as always, grab your favorite cup of tea or coffee, settle in, and let's talk about the science of IV therapy and why it's becoming a game changer in the world of health optimization. So let's start with the basics. IV therapy, or intravenous therapy, delivers fluids, vitamins, minerals, and other nutrients directly into your bloodstream, bypassing digestive system entirely. And this is not a new concept. Hospitals have used IV fluid delivery for over a century. What's new is how we're applying this technology for preventative health and performance optimization. The science behind IV therapy is straightforward but powerful. When you take an oral supplement, it must pass through your digestive system, where several factors limit absorption. First, your stomach acid breaks down many nutrients before they can be absorbed. Second, your digestive tract has limited absorption capacity, what scientists call bioavailability. And third, certain health conditions and medications can further reduce this absorption. Research published in the Journal of Parenteral and Enteral Nutrition shows that even in healthy individuals, oral vitamin C absorption maxes out at about 200 to 250 milligrams per dose, with the rest being excreted. This is why when you take those 1,000 milligram vitamin C tablets, you often end up with expensive urine or stool if it causes what we call a flush, rather than therapeutic blood levels. In contrast, IV delivery achieves 100% bioavailability because it bypasses these digestive limitations. A 2019 study in the Journal of Translational Medicine found that IV vitamin C could achieve blood concentrations up to 70 times higher than what's possible with oral supplementation. Those aren't just numbers. That's the difference between being a therapeutic effect and a minimal impact. The key advantages of IV therapy include complete absorption. Every molecule of nutrient delivered goes directly into circulation. Higher dosing potential. Therapeutic doses impossible to achieve orally. Immediate effects. No waiting for digestion and absorption. Customized formulations. Tailored combinations based on individual needs. This is why we see such dramatic responses in certain patients. It's not placebo, it's physiology. Now, not all IVs are created equal. Let's explore the most common formulations and the science behind their benefits. A Myers cocktail, very common. This is the original IV nutrient therapy developed by Dr. John Myers in the 1970s. The classic formulation includes magnesium, calcium, B vitamins, and vitamin C. A study published in the Journal of Alternative and Complementary Medicine found that Myers cocktails recipients experienced significant improvement in fibromyalgia symptoms, including pain and fatigue. It's considered the foundation formula that works well for general wellness, immune support, and energy enhancement. High-dose vitamin C. This isn't just about preventing scurvy. At IV doses, vitamin C functions differently in the body. Research from the National Institutes of Health shows that while oral vitamin C acts primarily as an antioxidant, intravenous vitamin C at high doses, typically 25 to 50 grams, can generate hydrogen peroxide, which selectively damages cancer cells while leaving healthy cells unharmed. A 2020 review in the journal Nutrients confirmed that high-dose vitamin C can reduce inflammation, fight infection, and may help improve outcomes when used alongside conventional cancer treatments. Linus Pauling actually received the Nobel Peace Prize for high-dose vitamin C research. NAD+, nicotinamide adenine dinucleotide. That's a mouthful. This coenzyme is essential for cellular energy production and DNA repair. NADH levels naturally decline with age, and research in Nature Communications suggests this decline contributes to many aspects of aging. IV NADH therapy can take several hours to administer, but has shown promising results for neurological recovery, addiction treatment, and cognitive performance. A 2018 study in the journal Cell Metabolism found that restoring NAD+ levels improved mitochondrial function and reversed certain aspects of aging in animal models. Glutathione, often called the body's master antioxidant, glutathione is produced naturally in our liver, but becomes depleted with age, illness, and toxin exposure. It's poorly absorbed orally, making IV delivery particularly valuable. Research published in Clinical Pharmacokinetics confirms that IV glutathione achieves significantly higher blood levels than oral supplementation. Benefits include detoxification support, immune enhancement, and reduced oxidative stress. Some patients report improvements in inflammatory conditions, fatigue, and even skin quality. Hydration formulas. Sometimes the simplest interventions are the most powerful. Basic hydration IVs containing electrolytes can rapidly restore fluid balance. A study in the Journal of Strength and Conditioning Research found that IV hydration restored exercise performance more quickly than oral hydration in dehydrated athletes. For anyone with intense physical demands, travel fatigue, or recovery needs, proper hydration at the cellular level can be transformative. Chelation therapy. This specialized treatment uses agents like EDTA to bind to heavy metals in the bloodstream, allowing them to be excreted. The TACT Trial to Assess Chelation Therapy study, published in JAMA, found that chelation therapy reduced cardiovascular events in patients with a history of heart attack, particularly those with diabetes. While more research is still needed, this suggests potential benefits beyond metal detoxification. As with any medical intervention, the key is personalization. The most effective approach matches the specific formulation to your individual health needs, which is why professional assessment before beginning IV therapy is essential. While IV therapy can benefit many people, certain groups tend to see particular significant results. Let's explore who might consider this approach and when it's most valuable. Athletes and active individuals. For those pushing their physical limits, nutrient demands increase dramatically. Research published in the Journal of International Society of Sports Nutrition found that IV therapy improved recovery times and reduced muscle damage markers after intense exercise compared to oral hydration alone. Elite athletes often use IV therapy during intense training blocks or between competitions to maintain peak performance and accelerate recovery. Individuals with absorption issues. People with GI conditions that impair nutrient absorption, like Crohn's, ulcerative colitis, celiac disease, SIBO, often struggle to maintain optimal nutrient levels through diet alone. A study in the American Journal of Gastroenterology showed that IV nutrient therapy improved quality of life measures and reduced fatigue in patients with inflammatory bowel disease, IBD. If you've been diagnosed with malabsorption issues, IV therapy can be particularly valuable for you. Those with chronic fatigue and fibromyalgia. These complex conditions often respond poorly to conventional treatments alone. A randomized controlled trial published in the Journal of Alternative and Complementary Medicine found that patients receiving weekly Myers cocktails infusions experienced significant improvement in tender points, pain scores, and overall quality of life compared to the placebo group. For these patients, IV therapy may provide relief when other approaches fall short. Individuals recovering from illness or surgery. Recovery periods demand additional nutrients to rebuild tissues and restore normal function. Research in the Journal of Surgical Research demonstrates that IV nutrient therapy can reduce hospital stays and complication rates following major surgery. The combination of hydration, electrolytes, and key nutrients creates an optimal internal environment for healing. Busy professionals with high stress loads, like myself, chronic stress depletes essential nutrients, particularly B vitamins and magnesium. A study in the Neuropsychobiology found that IV magnesium and B vitamins administration reduced perceived stress and improved stress resilience more effectively than oral supplementation. For the chronically busy and stressed, periodic IV therapy can help replenish what lifestyle depletes. When is IV therapy most valuable? Acute situations often show the most dramatic results. Whether you're recovering from a virus, preparing for a major athletic event, or experiencing a particularly high stress period. However, research in the Journal of Clinical Investigation suggests that consistent periodic therapy may provide cumulative benefits for certain chronic conditions through what's called metabolic resetting. It's worth noting that IV therapy isn't meant to replace healthy lifestyle practices. Rather, it works best when combined with proper nutrition, adequate sleep, stress management, and appropriate exercise. Think of it as a powerful complement to these foundational health practices, especially when your body faces increased demands or challenges. Now, as with any medical treatment, safety should be our first consideration when exploring IV therapy. Let's discuss important safety aspects, potential risks, and how to find quality care. Now, the safety profile. When properly administered by qualified professionals, IV therapy has an excellent safety profile. A comprehensive review published in the International Journal of Clinical Practice examined thousands of IV nutrient therapy sessions and found adverse effects occurred in less than 3% of cases, with most being minor issues with temporary discomfort at the injection site. However, IV therapy is still a medical procedure that involves direct access to the bloodstream, and this means proper medical oversight is non-negotiable. Potential risks and contraindications. While rare, risks can include infection at the injection site, vein irritation or inflammation, especially with high-dose vitamin C, allergic reactions to components, fluid overload in those with certain heart or kidney conditions. Individuals with the following conditions should exercise caution and may not be candidates for certain IV therapies: congestive heart failure, severe kidney disease, certain electrolyte imbalances, and the history of adverse reactions to IV therapies. Now, according to the study in the American Journal of Medicine, most adverse events are preventable with proper patient screening and formulation selection. This highlights why qualified medical oversight is essential. Finding quality care. Not all IV providers are created equal. And here's what to look for. Medical supervision. Treatment should be overseen by a licensed healthcare provider with very specific training in IV therapy. Individualized assessment. Quality providers perform through health assessments before treatment, including relevant lab work when appropriate. A clean, dedicated environment. IV therapy should be administered in a clean, clinical setting with proper protocols for infection control. Pharmaceutical grade ingredients. Reputable providers use only high quality tested ingredients from licensed compounding pharmacies. Emergency protocols. The facility should have clear procedures and equipment for handling rare but possibly adverse reactions. Research published in the Journal of Infusion, Nursing emphasizes that provider qualifications are the strongest predictor of safety in outpatient IV therapy. Don't hesitate to ask providers about their credentials, experience, and safety protocols. Some key questions to ask your IV provider. Unfortunately, many drip bars employ technicians who can insert IVs but lack deeper medical knowledge to ensure you're getting proper care. Ask these questions. Who formulated my IV protocol, and what's their medical background? The answer should include a physician, a nurse practitioner, or a licensed provider with specific IV therapy training. What symptoms might indicate an adverse reaction, and how would you respond? Qualified providers should immediately mention signs like chest tightness, difficulty breathing, or sudden pain, and have a clear emergency protocol. How do you determine the appropriate dosing for my specific situation? They should mention factors like your weight, medical history, and current health status, not just offer a standard menu approach. What's in the specific formulation and why was each compound selected? The person inserting your IV should understand exactly what they're administering and why. Do you have a physician or advanced practice provider on site or immediately available? This is crucial for addressing any unexpected reactions. If your provider struggles to answer these questions or seems unsure, consider it a red flag. Remember, you're allowing someone direct access to your bloodstream. This requires proper medical expertise, not just technical skills with a needle. Cost considerations. IV therapy is typically not covered by insurance when used for wellness or performance optimization, though some plans may cover it for diagnosed conditions like dehydration or specific nutrient deficiencies. Costs typically range from $100 to $300 for basic formulations to $500 to $1,000 for specialized therapies like high-dose vitamin C or NADH. When evaluating cost, consider the bioavailability aspect. What you observe, not just what you pay for. A $30 oral supplement that's 20% absorbed may provide less actual benefit than a $150 IV that's 100% absorbed. The field of IV nutrition and IV therapy is evolving rapidly, with exciting research expanding our understanding of its applications. Let's look at some of the most promising developments. Cancer support applications. While IV therapy should never replace conventional cancer treatments, research is examining its role as a complementary approach. A 2020 study in the Frontiers in Oncology found that high-dose IV vitamin C alongside standard chemotherapy reduced side effects and improved quality of life measures compared to chemotherapy alone. Meanwhile, the GRAIL test we discussed in our previous episode represents another breakthrough in cancer care. Early detection through blood testing that can identify more than 50 types of cancer, often before symptoms appear. Longevity and anti-aging applications. NADH plus therapy is at the forefront of longevity research. A 2022 review in Nature Aging highlighted how IV NADH replenishment may counteract aspects of cellular aging by improving mitochondrial function and DNA repair. Ongoing clinical trials are investigating whether regular NAD plus therapy can extend not just lifespan, but health span, the period of life spent in good health. Personalized formulations based on genetic testing. Well, we're moving toward personalized IV therapy. Research published in the Journal of Nutrigenetics and Nutrigenomics demonstrates that genetic variations affect how individuals respond to different nutrients. Forward-thinking practitioners are beginning to use genetic testing to customize IV formulations based on individual genetic profiles. And neurological applications. Perhaps most exciting is the research into IV therapy for neurological conditions. A 2021 study in Scientific Reports found that specialized IV nutrient formulations improved cognitive measures in patients with mild cognitive impairment. Meanwhile, trials are underway examining high-dose glutathione for Parkinson's disease, symptoms and specialized nutrient combinations for traumatic brain injury, and even phosphatidylcholine IVs for neurological conditions like MS, along with NAD. This is something that I did when I was diagnosed with MS, and it made a huge difference for me in my symptoms. Home-based IV therapy advances in medical technology are making medically supervised home IV therapy increasingly viable. A study in the Journal of Infusion Nursing found that properly managed home IV programs maintained safety profiles comparable to clinical-based administration while improving patient comfort and compliance. What these developments tell us is that we're just beginning to understand the full potential to direct to bloodstream nutrient delivery. Even though it's been going on since the 70s, medicine is kind of slow. As with any evolving field, it's important to maintain both optimism and scientific rigor, following the research rather than the hype. IV therapy represents a powerful tool in our health optimization toolkit, not a miracle cure, but a science-based approach to delivering precisely what your body needs, exactly where it needs it. If you're considering IV therapy, here are your next steps. Consult with a qualified healthcare provider who specializes in functional or integrative medicine to determine if IV therapy aligns with your health needs and goals. Consider relevant testing to identify specific deficiencies or needs that would benefit from IV therapy. This might include micronutrient testing, hormone panels, or genetic testing. Start with fundamentals first. Optimize your diet, sleep, and stress management before or alongside IV therapy for best results. Be realistic about expectations. While many experience scientific benefits, individual responses vary based on your unique biochemistry and health status. Think strategically about timing. Consider scheduling IV therapy during periods of high stress, intense physical demands, or recovery phases when your body would most benefit from additional support. Remember that even the most powerful intravenous work best as part of a comprehensive approach to health. IV therapy can provide a valuable boost, but it works synergistically with the foundations of good health: nutrition, movement, sleep, stress management, and a meaningful connection. By combining these cutting-edge approaches like IV therapy with timeless health principles, we can create truly optimal health that goes beyond merely avoiding illness to achieving vibrant wellness and performance. Thank you for joining me today on Let's Talk Wellness Now. If this episode sparked your curiosity about IV therapy, I encourage you to continue exploring this with a qualified healthcare provider who can help you determine if this approach is right for your specific needs. On our website, you'll find a free downloadable guide with questions to ask potential IV therapy providers, along with a checklist to help evaluate facilities. Next week, we'll be exploring the gut brain connection and how the health of your microbiome affects everything from your mood to your immune function and even your food cravings. Before we go, I want to emphasize one final point. When seeking IV therapy, make sure the person administering your treatment fully understands what they're doing. Many trendy IV lounges employ technicians who know how to insert a needle, but lack the medical knowledge to monitor for adverse reactions or explain why specific nutrients are being used. Always ask who formulated your protocol and ensure the person inserting your IV can explain exactly what's in it and why. Your bloodstream deserves nothing less than expert care. Until then, take care, stay curious about your health, and remember, optimal wellness comes from combining the best of traditional wisdom with the most promising advances in modern science. This is Dr. Deb for Let's Talk Wellness Now, reminding you that true wellness begins with understanding your body and how it works and giving it what it truly needs.
Thank you for listening to the podcast. Let's Talk Wellness Now brings expert insights directly to you. Please note that the views and information shared by our guests are their own and do not necessarily reflect those of Let's Talk Wellness Now, its management, or our partners. Each affiliate, sponsor, and partner is an independent entity with its own perspectives. Today's content is provided for informational and educational purposes only and should not be considered specific advice, whether financial, medical, or legal. While we strive to present accurate and useful information, we cannot guarantee its completeness or relevance to your unique circumstances. We encourage you to consult with a qualified professional to address your individual needs. Your use of information from this broadcast is entirely at your own risk. By continuing to listen, you agree to indemnify and hold Let's Talk Wellness Now and its associates harmless from any claims or damages arising from the use of this content. We may update this disclaimer at any time, and changes will take effect immediately upon posting or broadcasts. Thank you for tuning in. We hope you find this episode both insightful and thought-provoking. Listener discretion is advised.